moves to have increases for MLA's expenses. It's quite shocking that there's going to be one rule for MLAs and another for NHS workers who were, like I said, clapped and applauded. So I want to raise this directly with the Health Minister today.
Is it just at hospitals or is it elsewhere?
Well, I think there's a question about all healthcare workers, having to pay. I mean, we hear of cases as well where care workers in the community are having to pay for mileage and parking as well. So I think we need to have a system in place that healthcare workers aren't being forced to pay out of their own pocket for parking, for mileage, and that's a whole different question as well. But I think this question has to be answered by the Minister. What is his plans? Why is he moving to stop the free parking? And I think it's something that is popular amongst lots of, obviously, healthcare workers, but also the community who supported him, like I said, throughout the pandemic.
And does the money go into the health service, or does the money go to private operatives of the car parks?
It's my understanding that money did go to private companies. I'm not sure if that has changed yet. There was a conversation taking place or due to take place in Trust about possibly bringing it in-house. I know certainly previous years it was going to private companies, but I'm not sure if that's still the case present. But I mean, it's the case that my understanding is a lot of corporations private companies made a lot of money off the back of patients, obviously, but also healthcare workers, and that's obviously unacceptable. And the NHS shouldn't exist in hospitals and healthcare settings, shouldn't exist to allow private companies to profit off the public and off staff. So that's another concern that has been raised with me.
But would there be space for visitors to park if every member of staff had free parking in our hospital car parks?
Well, that's something that the Trust needs to look at and answer, but from our end, obviously, there's a whole question about parking and buildings and public buildings being designed for people to travel into it, be it on buses, be it on cars, and so on and so forth. But I think the issue that I'm raising today is the one about healthcare workers being directly charged for the right, essentially, to go to work, and these are some of the workers who are some of the most lowest paid in our society. They had some of them strike earlier this year to get a fair pay deal because the ministers, successive health ministers and executives, didn't support them financially. So I think the least that the government can do now, the health minister and the executive can do now, is to further extend the free parking for these workers so they're not forced to pay more out of their own pocket to travel and to work, to treat our citizens, to treat our community, and to deliver essential health services.